Hello, and welcome back to another episode of Keeping Up with the GSD'ers. On today's show, we will be featuring Lily, Braulio, Axelle, and Victoria with a rapid-fire section to end it off. Thank you, and enjoy today's episode. Now, Lily, what is your topic?
I'm researching the impact of quality, accessible prosthetics on a Paralympic athlete's performance.
Why are you interested in your topic?
So I first got interested in prosthetics and studying the topic from my uncle. So in 2008, he lost his leg to a landmine while deployed with the Army in Afghanistan, and I grew up around him and his prosthetics, and I've always been fascinated by it, and I want to continue studying prosthetics in college. I looked up to my uncle as a hero, so a chance to make his life better by building a better prosthetic is definitely a dream for me. I also love playing and watching sports, and I believe that everyone should have the opportunity to play regardless of disability. This project is sort of the perfect intersection between my love of sports and interest in prosthetics, and it also has a really big implication for athletes around the world, especially those who don't have the same access to healthcare, sports medicine, and technology as we do here in the U.S.
Thank you, Lily. It's very interesting. What have you found out about your topic so far?
So I found that affordability is the number one barrier to obtaining a prosthetic in low and middle income countries because total costs of a prosthetic can be up to $1 million over your lifetime. And that also doesn't account for any loss of wages or salary because you can't work after you get the amputation, which is another big issue for amputees. I've also looked at how we can make prosthetics more affordable and accessible with this being the number one barrier. And I've learned that the materials that we make the socket with is a big part of the cost of the actual prosthetic. So right now it's usually made of carbon fiber and has to be fitted multiple times, but if you use 3D printing to make the manufacturing process less expensive, you can use that so that there only has to be one fitting instead of multiple fittings. And I've also done a mini sort of case study about Kenya at the 2024 Olympics versus Paralympics. So Kenya was the second most successful nation in track and field at the Olympics, only behind the US. But at the Paralympics, they had 0 medals and had no athletes competing in events with prosthetics. So this shows us kind of the disparity between the Olympics and the Paralympics and how socioeconomics can impact a country's performance.
How will your research benefit the community we are in, either in FES, Colorado, or further abroad?
So obviously our city, Colorado Springs, is home to a large number of active military and veterans, and many of which are amputees. And we're also home to the Olympic and Paralympic Training Center and the Olympic and Paralympic Museum. So in a way, the city is kind of a reflection of my combination of interests with sports and prosthetics. So hopefully my research can help make prosthetic running blades more affordable and get more amputees involved in sports in Colorado Springs.
Very interesting, Lily. What is your next step in your research?
I have a few next steps. One of them is reaching out to the Olympic and Paralympic Museum to use their knowledge about prosthetics to add to my research and get their point of view about what's most needed for Paralympic prosthetics. Mm-hmm. I also want to schedule an interview with Ati, who I met when he was here with the African delegation from Senegal, and he runs sports camps for kids with disabilities there, which is pretty cool. So I want to learn about sort of his perspective on what is most needed abroad. And finally, I also want to reach out to an online creator that I follow whose name is Alex, and he ran a marathon on crutches to raise awareness about the cost of prosthetic running blades. And that aligns with my cause super well, and I think he's a super cool guy. So I want to reach out to him to learn more about his perspective and his experience with using a prosthetic.
Thank you, Lily, for sharing your research and your story.
Thanks.
Hi, Braulio.
Hey, Lucas.
What is your topic for GSD?
Well, my topic is looking at diversity in Southern Colorado and how embracing it can empower our local community.
Very interesting. So, firstly, why are you interested in your topic?
Well, having lived in Southern Colorado, I've grown up in an environment where diversity is often overlooked within the community. Being at a school like Fountain Valley has allowed me to experience the benefits that diversity brings to a community. It doesn't only expand our ability to take on new perspectives, but it pushes us to cooperate with others and to learn how valuable communication and understanding really is. All that said, I had a desire to dive further into the history and outlook of this dynamic here where we live.
Very interesting, Braulio. What have you found about your topic so far?
Well, after a lot of research and analyzing several case studies, some of the few points that I've come across is that Southern Colorado is heavily populated with Hispanic residents. And through these case studies that I looked at and research papers that I've read, a lot of the disparities in our community that our community experiences disproportionately affects Hispanic residents. This can be observed in a variety of ways, such as median household income, the percentage of adults that have college degrees, and the quality of education available to this community.
How will your research benefit the community we are in, either in Colorado Springs or FES or abroad?
Totally. Well, I believe that nowadays people often see others advocating for a variety of social issues surrounding political topics and other stuff, and they often ask themselves, well, why? Hopefully, my research can bring to light as to why diversity in our communities is not only essential, but beneficial. I find that people are usually more open to new ideas or reform when they can visualize how they individually might benefit from it.
Lastly, what is your next step?
Well, for this next phase of my research, I intend on getting data and knowledge on this topic, not from a book or a paper, but from the community itself. Through conversation, I'm sure I'm going to gain a new perspective on diversity and hear lots of valuable points. It's always important to understand where the community you are learning about is coming from in terms of analyzing not only the social situation in that community, but also the economical and political situation. I think that there's lots of factors that have contributed to the modern context of Southern Colorado and in regards to diversity, and I aim to reveal that by talking to the people that have experienced the story.
Thank you, Braulio.
Thank you.
Hi, Axelle. What is your topic?
So my topic is on medical deserts in rural America.
Okay, very interesting. So my first question for you today, why are you interested in your topic?
So I am an aspiring doctor, maybe, and I am really interested in looking at the pros and cons of the U.S. healthcare system and how there's a lot of gaps in its accessibility to a lot of different groups of people, specifically in rural areas. And I grew up mainly living in really big cities, and then when I moved to Colorado Springs, I learned that also a lot of how these smaller hospitals have a lot less technology, and doctors aren't as trained with using equipment and stuff like that. So yeah.
Wow, that's very interesting. It seems like you have a very personal connection to your topic. So what have you found about your topic so far?
So I've learned about how many of these medical deserts really affect the quality of healthcare, specifically with cancer treatments. For example, people in rural areas are 30% more likely to have invasive treatment on the first round of treatment instead of having chemo or other medications. Along with that, I've also learned that a lot of people of color, specifically indigenous people that live in rural areas, have little to no access to healthcare, and indigenous people also don't have access to healthcare insurance and have to pay for everything out of pocket when they're the most impoverished group in our country. So that was a sad thing to hear.
How would your research benefit the community we are in?
Living in southern Colorado, there are a lot of small rural communities on the prairie and in the mountains that cannot access adequate care due to lack of staffing, geographic features, not enough funding, and clinics or hospitals which aren't properly updated. Although this issue is often overlooked, it is crucial to raise awareness about it, especially in states such as Colorado, which have many small towns and rural landscapes, and fixing these healthcare areas could allow them to grow and prosper. Along with this, it could provide more jobs for people in these areas, which are usually of lower socioeconomic class.
Lastly, what is your next step in your research and your project overall?
So for my next step, I'm actually going to travel to Alamosa, Colorado with my mom because she's a doctor and she is required to volunteer there since they don't have enough specialized doctors in her field. And during my time there, I will compare the facility to the hospital which I volunteer at in Colorado Springs, as well as talk to staff and patients and listen to their experiences with their healthcare system in such a remote town and the nearest big city over 3 hours away. And this will allow me to get firsthand experience for my data and truly understand the difficulties of accessing healthcare in these areas.
Okay. Thank you, Axelle. Victoria, what is your topic and what are you researching?
I am researching how Venezuela's political, economic, and social crises have converged to impact the accessibility and quality of its public health and healthcare system.
Very interesting. Why are you interested in your topic?
I aim to bring attention to the humanitarian consequences of the ongoing crisis in Venezuela. Healthcare is frequently overlooked in discussions of the humanitarian crisis, but it is central to the ongoing struggles that millions of Venezuelans are facing today. As a Venezuelan who lived there until the age of 9, I witnessed the devastating impact the crisis has had on the quality of medical care, and as a result, the lives of countless individuals. Through my research, I aim to go beyond the misleading stories often portrayed in the media and provide accurate picture of how this situation is affecting Venezuelans.
Wow, thank you for that. That's a very powerful anecdote. What have you found out about your topic so far, and where has your research led you?
Corruption has significantly worsened Venezuela's healthcare crisis. Funds intended for healthcare are often stolen or spent improperly, leaving hospitals without adequate funding, essential medications, or working equipment. Supplies frequently end up on the black market, making them hard to access. Nepotism has placed unqualified individuals in important roles, creating inefficiencies and further damaging the system. At the same time, the failure of basic services has led to unsanitary hospital conditions and the return of diseases that were previously eradicated. These issues have resulted in preventable deaths.
How do you plan to implement your research into the FES community or a different community? And what is the real-world impact of your research?
Well, I think it's easy to make assumptions based on surface-level knowledge, but being truly informed is crucial before passing any judgment. Raising awareness about these issues can empower people to act with empathy. When we take the time to really understand what's behind a situation like Venezuela's, we can better contribute to solutions that make a real difference. To me, being informed is the first step towards actually making change happen.
Thank you. And lastly, what is your next step?
I'll be reaching out to medical professionals and recurrent patients to gather more first-hand accounts, as my current focus has primarily been on statistical and academic articles.
Thank you, Victoria.
Thank you.
Okay, everyone, now it's time for the rapid-fire questions section. Woo!
Woo! Excited.
So, our first question. If animals could talk, which one would be the rudest?
Alligators.
The rudest. I feel. Ooh, that's a really good question. I think honey badgers would be pretty rude. I feel they're very feisty, so I think they'd have a lot to say.
Cockroaches. I'm gonna go wasp. What do they have to contribute? Nothing. Wasp.
That's fair. What's your go-to comfort food?
Indian food.
Venezuelan empanadas.
Pasta. Any type of pasta.
Oh, I think mine has got to be either potato chips or popcorn.
Okay. What's your favorite way to waste time?
Watching Netflix.
Shoot, I mean, it's gotta be like playing video games.
Probably just scrolling.
You know, I think I have to agree with the video games. I always like a good video game sesh.
Okay. What's your most controversial pizza topping option?
Pineapple does go on pizza.
Ooh, okay, that's very controversial.
I like artichokes on my pizza.
What?
Yeah, that's my favorite pizza topping is artichokes.
No.
Yeah, I know. It's really bad.
Really?
I know.
I don't know if any of mine are controversial. I guess, I don't know. I like jalapenos on my pizza.
I like jalapenos on my
But I don't
pizza.
think that's controversial.
That's good.
Yeah, I don't know. Maybe. Well, I've heard people don't like olives or mushrooms on the pizza, but I don't mind.
I really like olives.
I don't mind either.
I don't like olives.
I'll
I don't mind
have
either.
Actually, wait, I'm not being asked the questions. Okay. If you were a kitchen utensil, what would you be and why? And this is our last question.
A KitchenAid, because it's like so versatile and you can use it for so many things. Like you can't never go wrong with a KitchenAid.
That's fair.
I'd be a spork. It can do everything. Like, if you could be a spoon, you could be a fork. Like, I've also, when I was in elementary school and they used to give us sporks at lunch, I would use that as my knife, too. So, like, you could use it for everything. So, yeah, spork.
Maybe a fork.
All right.
I think a spoon. I think I'm feeling spoon.
Filled spoon.
Yeah.
How are you gonna eat all the fork foods though?
How are you eating noodles with a spoon?
That was not the question.
All right, that's going to be it for today. Thank you for indulging in our rapid fires.
Bye.